Question 1. Analysis of how a graduate student in a health program should approach understanding a client's persistent anxiety, considering the applicability of different psychological theories. The student has been exposed to psychodynamic, cognitive behavioral, and humanistic theories. Which approach best reflects best professional practice in this context? Option A. Rely solely on psychodynamic interpretations to explore unconscious conflicts as the root cause of the client's anxiety, without considering other contributing factors. Option B. Focus exclusively on cognitive behavioral techniques, as anxiety is primarily a learned response that can be unlearned through direct behavioral modification. Option C. Adopt a purely humanistic approach, emphasizing the client's self-actualization and inherent goodness, and assuming anxiety will resolve as the client achieves greater self-acceptance. Option D. Prioritize a comprehensive assessment that integrates insights from psychodynamic, cognitive behavioral, and humanistic theories to develop a multifaceted understanding and intervention plan. Correct answer is D. Prioritize a comprehensive assessment that integrates insights from psychodynamic, cognitive behavioral, and humanistic theories to develop a multifaceted understanding and intervention plan. Explanation. Scenario analysis. This scenario presents a common challenge in health graduate programs where students are expected to apply theoretical psychological concepts to practical situations. The difficulty lies in discerning the most appropriate theoretical lens to understand and address a client's presenting issues, especially when multiple theories offer partial explanations. Professionals must exercise careful judgment to avoid oversimplification or misapplication of theories, which can lead to ineffective or even harmful interventions. The ethical imperative is to select an approach that is evidence-based, client-centered, and respects the complexity of human behavior. Correct approach analysis. The correct approach involves a nuanced understanding of how different psychological theories can inform an assessment and intervention plan. It recognizes that a single theory may not fully capture the client's experience, and that an integrative or eclectic approach, grounded in a strong theoretical foundation, is often most effective. This approach prioritizes a comprehensive assessment that considers biological, psychological, and social factors, aligning with a biopsychosocial model often emphasized in health graduate programs. The justification for this approach lies in its ability to provide a more holistic and personalized understanding of the client, leading to more tailored and effective interventions. It reflects best professional practice by acknowledging the limitations of any single theoretical framework and advocating for a flexible, evidence-informed application of psychological principles. Incorrect approach is analysis. One incorrect approach is to rigidly adhere to a single theoretical perspective, such as solely focusing on behavioral conditioning to explain complex emotional distress. This fails to account for cognitive, emotional, and interpersonal factors, potentially leading to an incomplete assessment and an intervention that addresses symptoms without tackling underlying causes. This approach risks violating ethical principles of competence and due care by providing a superficial understanding of the client's issues. Another incorrect approach is to dismiss the relevance of established psychological theories altogether, opting for an intuitive or purely anecdotal approach. This is professionally unacceptable, as it bypasses the rigorous research and empirical evidence that underpins psychological theories. It can lead to interventions that are not evidence-based, potentially causing harm and failing to meet professional standards of practice. Such an approach neglects the foundational knowledge expected of graduates in health programs. A third incorrect approach involves selectively applying theoretical concepts without a coherent framework or a clear rationale. This can result in a fragmented understanding of the client and an intervention plan that lacks direction and consistency. It demonstrates a superficial grasp of the theories, failing to integrate them into a meaningful clinical picture. This can lead to ineffective treatment and a failure to uphold professional responsibilities to provide competent care. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the client's presenting problems, history, and context. This assessment should be informed by a broad understanding of various psychological theories. The next step involves critically evaluating which theoretical frameworks best explain the observed phenomena, considering their strengths and limitations in relation to the client's specific situation. Professionals should then formulate an intervention plan that integrates relevant theoretical principles in an evidence-based and client-centered manner. This process requires ongoing reflection, consultation with supervisors or peers when necessary, and a commitment to continuous learning and adaptation. The ultimate goal is to provide the most effective and ethical care possible, grounded in sound psychological principles. Question 2. Market research demonstrates that a significant portion of graduate students struggle to differentiate between an author's objective presentation of data and their underlying persuasive intent in health-related academic articles. When evaluating a research paper on a novel public health intervention, which analytical approach best demonstrates a sophisticated understanding of the author's tone and purpose, moving beyond superficial comprehension? Option A. Analyzing the author's word choice, the framing of arguments, and the selection of evidence to infer their attitude and ultimate goal. Option B. Summarizing the key findings of the study without considering the author's commentary or concluding remarks. Option C. Focusing on the author's credentials and the publication's impact factor to gauge the trustworthiness of the information. Option D. Identifying the author's primary research question and the statistical methods used to answer it. The correct answer is D. Identifying the author's primary research question and the statistical methods used to answer it. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires discerning the author's underlying intent and emotional stance within a health-related context, which is crucial for accurate interpretation and responsible application of information. Misinterpreting tone or purpose can lead to flawed decision-making, miscommunication, and potentially harmful actions, especially in fields governed by strict ethical and regulatory standards for health information dissemination and use. The GRE context implies a need for critical evaluation of academic and professional literature, where authorial voice significantly impacts the credibility and utility of the content. Correct approach analysis. The correct approach involves a thorough examination of the author's word choice, sentence structure, and the overall context of the writing to infer their attitude and objective. This aligns with best professional practice in academic and health-related fields by promoting critical thinking and evidence-based interpretation. Regulatory frameworks, while not explicitly detailed for the GRE, implicitly endorse such analytical rigor as essential for understanding research, policy, and professional discourse. Ethically, it ensures that information is not taken at face value, but is understood in its intended light, preventing misrepresentation or misuse. Incorrect approaches analysis. One incorrect approach would be to focus solely on the factual content presented, ignoring any subtle cues about the author's perspective or intent. This fails to meet the professional standard of comprehensive analysis, as tone and purpose often shape the presentation and emphasis of facts, potentially introducing bias or a specific agenda. This approach risks overlooking crucial nuances that could affect the validity or applicability of the information, a failure in due diligence expected in health-related graduate studies. Another incorrect approach would be to project personal biases or assumptions onto the author's writing. This is a significant ethical and professional failing, as it compromises objectivity and leads to a distorted understanding of the material. In health-related fields, such subjective interpretation can lead to misdiagnosis, inappropriate treatment recommendations, or flawed research conclusions, directly contravening principles of evidence-based practice and professional integrity. A third incorrect approach would be to assume the author's purpose is purely to inform, without considering potential persuasive or advocacy elements. While informing is often a primary goal, authors may also aim to persuade readers to adopt a particular viewpoint or take specific actions. Failing to identify these underlying purposes can lead to an incomplete or misleading understanding of the author's message, hindering the ability to critically evaluate the information's implications. This is particularly relevant in health policy or public health communications, where advocacy is common. Professional reasoning. Professionals should approach texts by first identifying the explicit information presented. Subsequently, they must analyze the language used, looking for loaded terms, emotional appeals, or consistent framing that reveals the author's attitude, tone. Simultaneously, they should consider what the author aims to achieve with the text to inform, persuade, critique, or advocate purpose. This dual focus allows for a nuanced understanding that respects the author's voice while maintaining critical distance and objectivity, ensuring responsible interpretation and application of information within their professional domain. Question 3. The audit findings indicate a pattern of inconsistent documentation regarding patient consent for the sharing of electronic health records with external specialists. This inconsistency raises concerns about potential violations of patient privacy regulations and the integrity of patient care coordination. Which of the following approaches best addresses this situation? Option A. Conduct a superficial review of a small sample of recent consent forms to confirm that most are adequately documented, and proceed with existing protocols. Option B. Focus solely on disciplinary action for any staff members found to have contributed to the documentation inconsistencies, without altering the consent process itself. Option C. Issue a general memo to all staff reminding them of the importance of obtaining patient consent for data sharing, assuming the issue is isolated and will resolve with a reminder. Option D. Immediately revise the electronic health record system's consent module to require explicit, granular consent for each external sharing instance, and conduct mandatory retraining for all clinical staff on updated consent protocols. The correct answer is D. Immediately revise the electronic health record system's consent module to require explicit, granular consent for each external sharing instance, and conduct mandatory retraining for all clinical staff on updated consent protocols. Explanation. The audit findings indicate a potential breach in patient data privacy, a critical area governed by stringent regulations within the health sector. Challenge lies in balancing the need for comprehensive patient care with the imperative to protect sensitive health information from unauthorized access or disclosure. Professionals must navigate complex ethical considerations and legal mandates to ensure compliance. The correct approach involves a thorough, systematic review of the audit report to identify the specific nature and scope of the data privacy concerns. This includes pinpointing the exact systems, processes, or individuals involved in the potential breach. Subsequently, implementing immediate corrective actions, such as enhanced security protocols, staff retraining, and a review of access logs, is paramount. This methodical and proactive response aligns with best professional practices by prioritizing patient confidentiality, adhering to data protection laws, such as HIPAA in the U.S. context, which would be the relevant framework for a GRE health program exam focused on U.S. regulations, and demonstrating a commitment to patient trust. It ensures that the organization not only addresses the immediate issue, but also strengthens its overall data security posture to prevent future occurrences. An incorrect approach would be to dismiss the audit findings as minor or to implement superficial changes without a deep understanding of the root cause. This could involve simply updating a password policy without investigating why the breach occurred or who was affected. Such an approach fails to address the underlying vulnerabilities and could lead to repeated breaches, violating regulatory requirements for data security and patient privacy. Another incorrect approach is to delay action or to attempt to conceal the findings, which constitutes a significant ethical and regulatory failure. This not only undermines patient trust, but also exposes the organization to severe legal penalties, including fines and reputational damage, and violates the duty of care owed to patients. Furthermore, a reactive approach that only addresses the symptoms rather than the cause demonstrates a lack of professional diligence and a disregard for established data protection principles. Professionals should employ a decision-making framework that begins with a clear understanding of the relevant regulatory landscape. This involves identifying all applicable laws and guidelines pertaining to patient data privacy. Next, a thorough risk assessment should be conducted to evaluate the potential impact of the identified issues. This assessment should inform the development of a remediation plan that is both effective and compliant. Finally, continuous monitoring and evaluation are essential to ensure that corrective actions are sustained and that the organization remains vigilant against evolving threats to data security. Question 4. Research into the implementation of a new electronic health record system in a large hospital network has revealed several potential issues. Which of the following approaches to managing these issues best reflects a comprehensive risk assessment strategy for a healthcare organization? Option A. Focusing on identifying and mitigating risks that could lead to significant financial penalties or legal liabilities, as these are the most quantifiable threats. Option B. Prioritizing the resolution of issues that directly impede immediate patient care, deferring less urgent concerns to a later phase. Option C. relying on the IT department's initial assessment of system vulnerabilities and addressing only those issues flagged as critical by the vendor. Option D. Developing a systematic process to identify all potential hazards associated with the new system, analyze their likelihood and impact on patient safety and operational efficiency, and implement appropriate control measures. Correct answer is B. Prioritizing the resolution of issues that directly impede immediate patient care, deferring less urgent concerns to a later phase. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for patient care with the long-term implications of resource allocation and potential future risks. A healthcare professional must exercise careful judgment to identify and prioritize risks that could impact patient safety and organizational effectiveness. The correct approach represents best professional practice because it systematically identifies potential hazards, assesses their likelihood and severity, and develops strategies to mitigate them. This aligns with the fundamental ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Regulatory frameworks in health professions, while not explicitly detailed for GRE exam purposes, universally emphasize a proactive approach to patient safety and quality improvement, which inherently involves risk assessment. This approach ensures that decisions are evidence-based and consider the broader impact on patient outcomes and the healthcare system. An incorrect approach that focuses solely on immediate patient needs without considering broader systemic risks fails to uphold the principle of non-maleficence on a larger scale. It might lead to short-term solutions that create or exacerbate long-term problems, potentially harming more patients or compromising the quality of care in the future. Ethically, this is a failure of due diligence. Another incorrect approach that prioritizes cost saving above all else, without adequately assessing the impact on patient safety or the effectiveness of care, violates the principle of beneficence. It can lead to inadequate resources, compromised treatment protocols, and ultimately, patient harm. This approach demonstrates a disregard for professional responsibility and may contravene implicit or explicit regulatory expectations for quality patient care. A third incorrect approach that relies on anecdotal evidence or personal intuition rather than systematic data collection and analysis is professionally unacceptable. It lacks the rigor required for effective risk management and can lead to misidentification of true risks or the implementation of ineffective mitigation strategies. This undermines the evidence-based practice expected in healthcare and can lead to regulatory scrutiny if patient safety is compromised. The professional decision-making process for similar situations should involve a structured risk assessment framework. This typically includes 1. Hazard identification. What could go wrong? 2. Risk analysis. How likely is it to happen and what would be the consequences? 3. Risk evaluation. How significant is the risk? 4. Risk treatment. What can be done to reduce or eliminate the risk? 5. Monitoring and review. Are the implemented controls effective? This systematic approach ensures that decisions are informed, defensible, and focused on optimizing patient outcomes and organizational resilience. Question 5. The monitoring system demonstrates a subtle but significant shift in a patient's vital signs, communicated through the following output. Observation indicates a potential deviation from baseline parameters, warranting further investigation. Which of the following interpretations most accurately reflects the system's message and guides the most appropriate next step for a health graduate program participant? Option A. The system is flagging a critical emergency requiring immediate drastic intervention. Option B. The system is indicating a need for closer observation and data gathering to understand the nature and significance of the observed change. Option C. The system is suggesting a minor, possibly insignificant, fluctuation that can be ignored until the next scheduled check. Option D. The system is confirming a definitive diagnosis that requires immediate treatment initiation based solely on this output. The correct answer is A. The system is flagging a critical emergency requiring immediate, drastic intervention. Explanation. The monitoring system demonstrates a critical juncture where the interpretation of data directly impacts patient care and adherence to established health program guidelines. This scenario is professionally challenging because it requires not only an understanding of the data presented, but also the ability to discern the most accurate and ethically sound interpretation, which in turn dictates the appropriate course of action. The GRE, in its assessment for health graduate programs, aims to evaluate a candidate's capacity for such nuanced judgment, particularly in understanding how language and sentence structure convey meaning that can have significant real-world consequences. The correct approach represents best professional practice because it accurately interprets the data within the context of the monitoring system's intended purpose and the established protocols for health graduate programs. It demonstrates an understanding that the system is designed to flag deviations that require attention, and the phrasing of the system's output is crucial for determining the severity and nature of the deviation. This precise interpretation ensures that interventions are timely, appropriate, and aligned with the program's objectives, thereby safeguarding patient well-being and program integrity. An incorrect approach that misinterprets the system's output, perhaps by overemphasizing a minor anomaly or underestimating a significant one due to a misreading of the sentence structure, would represent a failure to adhere to the implicit or explicit guidelines governing the program. For instance, if the system's output is phrased to indicate a potential trend versus a confirmed critical value, misinterpreting this distinction could lead to unnecessary alarm or, conversely, a dangerous delay in necessary action. This failure stems from a lack of deep analytical skill in parsing the meaning conveyed by the sentence structure, which is a core competency assessed by the GRE. Another incorrect approach might involve making assumptions about the data that are not explicitly supported by the system's output, leading to a deviation from evidence-based decision-making, a cornerstone of professional practice in health fields. Professionals should employ a decision-making framework that prioritizes accurate data interpretation, contextual understanding, and adherence to established protocols. This involves carefully reading and dissecting the information presented, considering the source and purpose of the data, and then applying relevant knowledge and guidelines to determine the most appropriate response. When faced with ambiguous or complex information, seeking clarification or consulting with supervisors or established resources is a critical step in ensuring sound professional judgment. Question 6. Governance review demonstrates that a public health program has collected extensive data on disease prevalence and treatment outcomes. The program aims to analyze this data to identify trends and inform policy decisions, but concerns have been raised about the potential for individual patient re-identification if the data is shared too broadly. Which approach best balances the need for data analysis with the imperative to protect patient privacy and comply with relevant health data regulations? Option A. Rely solely on simple aggregation of data points without considering the potential for re-identification through contextual information, assuming aggregation inherently guarantees privacy. Option B. Immediately disseminate the raw, unaggregated data to all relevant stakeholders for independent analysis, trusting their individual discretion in handling sensitive information. Option C. Implement robust de-identification and anonymization protocols for the data before any analysis or dissemination, ensuring that the aggregated and analyzed findings can be shared without compromising individual privacy. Option D. Halt all data analysis and sharing indefinitely until a perfect, foolproof method for absolute data anonymity can be developed, which may take an indeterminate amount of time. The correct answer is C. Implement robust de-identification and anonymization protocols for the data before any analysis or dissemination, ensuring that the aggregated and analyzed findings can be shared without compromising individual privacy. Explanation. Scenario analysis. This scenario is professionally challenging because it involves balancing the need for timely data analysis to inform critical health program decisions with the ethical imperative of data privacy and security. The rapid dissemination of potentially sensitive health data, even in aggregated form, carries inherent risks of re-identification or misuse, necessitating a robust decision-making framework that prioritizes patient confidentiality and regulatory compliance. Correct approach analysis. The correct approach represents best professional practice because it adheres to the fundamental principles of data governance and ethical research conduct, which are paramount in health-related fields. Specifically, it prioritizes de-identification and anonymization techniques before broader dissemination, aligning with the spirit and letter of regulations designed to protect individual health information. This proactive measure ensures that, while insights can be derived and shared, the risk of compromising individual privacy is minimized, thereby upholding trust and legal obligations. Incorrect approaches analysis. One incorrect approach fails by prioritizing immediate access to raw data for analysis without adequate safeguards. This poses a significant regulatory and ethical failure by potentially violating data privacy laws and ethical guidelines that mandate the protection of sensitive health information. Such an approach could lead to breaches of confidentiality, legal penalties, and erosion of public trust. Another incorrect approach errs by delaying analysis indefinitely due to an overly cautious interpretation of data sharing protocols, hindering the program's ability to respond effectively to public health needs. Caution is warranted. An absolute embargo on data analysis without exploring de-identification options represents a failure to fulfill the program's mandate to use data for public good, potentially leading to missed opportunities for intervention and improved health outcomes. This approach neglects the principle of responsible data utilization. A third incorrect approach is to assume that aggregation alone is sufficient for de-identification without considering the context or potential for re-identification. This is a critical regulatory and ethical lapse, as even aggregated data can sometimes be linked back to individuals, especially when combined with other publicly available information. This oversight can lead to unintended privacy breaches and non-compliance with data protection standards. Professional reasoning. Professionals in health-related fields must employ a decision-making framework that integrates ethical considerations, regulatory compliance, and the practical needs of data utilization. This framework should involve a multi-step process. First, clearly defining the analytical objectives and the type of data required. Second, assessing the sensitivity of the data and identifying potential privacy risks. Third, implementing appropriate data protection measures, such as de-identification and anonymization, in accordance with established protocols and legal requirements. Fourth, establishing clear data access and sharing policies. And finally, regularly reviewing and updating these processes to adapt to evolving technologies and regulatory landscapes. This systematic approach ensures that data analysis serves its intended purpose, while upholding the highest standards of privacy and ethical conduct. Question 7. Which approach would be most appropriate for evaluating the potential impact of a novel health intervention based on its described functional properties, without relying on statistical data or clinical trial outcomes? Option A. Relying on testimonials from individuals who claim to have benefited from the intervention, regardless of the underlying functional explanation. Option B. Assessing the intervention based on the technical jargon and complexity of its functional description, believing that more intricate explanations indicate greater scientific rigor. Option C. Prioritizing interventions that are widely discussed in popular health media, assuming public interest reflects proven effectiveness. Option D. Analyzing the inherent mechanisms and logical consequences of the intervention's described function to predict its likely effects on physiological or psychological processes. The correct answer is D. Analyzing the inherent mechanisms and logical consequences of the intervention's described function to predict its likely effects on physiological or psychological processes. Explanation. This scenario presents a professional challenge because it requires an individual to evaluate the effectiveness and potential impact of a health intervention based on its underlying functional properties, without resorting to purely quantitative measures. The difficulty lies in discerning the qualitative implications of how a function operates and how that operation translates into real-world health outcomes, considering the ethical imperative to provide evidence-based and effective care. Careful judgment is required to move beyond superficial descriptions of a function to a deeper understanding of its mechanism and its potential benefits or harms. The correct approach represents best professional practice because it focuses on understanding the inherent characteristics of the intervention's function and how these characteristics align with established principles of health and well-being. This involves a critical assessment of the function's mechanism of action, its potential for unintended consequences, and its alignment with the goals of patient care. This aligns with the GRE's emphasis on evaluating candidates' ability to apply theoretical knowledge to practical health-related scenarios, requiring a nuanced understanding of how interventions work at a fundamental level. The regulatory framework for health professions, while not explicitly detailed here as per the exam's constraints, universally emphasizes evidence-based practice and patient safety, which are directly supported by this analytical approach. An incorrect approach that focuses solely on the perceived popularity or anecdotal success of an intervention fails to meet professional standards. This is because popularity does not equate to efficacy or safety, and anecdotal evidence is notoriously unreliable and prone to bias. Such an approach risks promoting interventions that are not scientifically validated, potentially leading to patient harm or the misallocation of resources. This represents a failure to adhere to the principle of evidence-based practice, a cornerstone of ethical and professional conduct in health fields. Another incorrect approach that relies on the complexity of the function's description as a proxy for its effectiveness is also professionally unacceptable. Complexity does not inherently imply superiority or efficacy. In fact, overly complex or poorly understood functions can be more difficult to implement safely and effectively, and may indicate a lack of clarity in the intervention's design or rationale. This approach fails to engage in critical evaluation and instead relies on a superficial characteristic, potentially leading to the adoption of ineffective or even harmful interventions. This demonstrates a lack of due diligence and a failure to apply critical thinking skills essential for health professionals. The professional decision-making process for similar situations should involve a systematic evaluation of any proposed health intervention. This begins with understanding the core function of the intervention and its theoretical basis. Next, one must assess the evidence supporting its efficacy and safety, considering the quality and robustness of the research. Crucially, the potential benefits must be weighed against any potential risks or harms, including unintended consequences. Finally, the intervention's alignment with ethical principles and patient-centered care goals must be considered. This structured approach ensures that decisions are grounded in evidence, ethical considerations, and a deep understanding of the intervention's functional properties. Question 8. The review process indicates that a predictive model used for resource allocation in a health graduate program has yielded a quadratic equation describing the relationship between patient readmission rates and the intensity of a new post-discharge support program. The roots of this equation are being discussed by the program's oversight committee. Which of the following interpretations of these roots best reflects a sophisticated understanding of their implications for program management and patient care? Option A. The roots signify the exact point at which the support program becomes either completely ineffective or overwhelmingly effective, with no intermediate outcomes possible. Option B. The roots are simply mathematical solutions to the equation and have no direct bearing on practical healthcare decisions. Option C. The roots represent the specific number of patients who will be readmitted under different program intensities. Option D. The roots indicate the critical thresholds of program intensity, where the model's predictive accuracy significantly changes, suggesting points for potential program adjustment or further investigation. The correct answer is C. The roots represent the specific number of patients who will be readmitted under different program intensities. Explanation: scenario analysis. This scenario presents a professional challenge because it involves interpreting complex data related to patient outcomes and resource allocation, which directly impacts patient care and institutional efficiency. The challenge lies in translating abstract mathematical concepts, like the roots of a quadratic equation, into actionable clinical or administrative decisions without oversimplifying or misinterpreting the underlying data. The pressure to make timely and evidence-based decisions, coupled with the need for accurate interpretation of statistical models, requires a nuanced understanding beyond mere calculation. Correct approach analysis. The correct approach involves recognizing that the quadratic equation's roots represent critical thresholds or inflection points in the predictive model. Understanding these roots allows for more sophisticated interpretation of the model's behavior, such as identifying the point at which a particular intervention becomes significantly more or less effective, or when resource utilization reaches a critical level. This approach aligns with best professional practice by using the mathematical output as a tool for deeper analytical insight into patient trends and operational dynamics, rather than as a direct, simplistic answer. It emphasizes the application of the mathematical concept to inform strategic decision-making, ensuring that interventions are evidence-based and resource allocation is optimized, thereby adhering to principles of patient advocacy and efficient healthcare delivery. Incorrect approaches analysis. One incorrect approach involves treating the roots of the quadratic equation as definitive, absolute predictions of future outcomes, without considering the model's limitations or the inherent variability in biological and operational systems. This fails to acknowledge the probabilistic nature of predictive models and can lead to overconfidence in flawed predictions, potentially resulting in inappropriate treatment plans or resource misallocation. Ethically, this can be seen as a failure to exercise due diligence in patient care. Another incorrect approach is to dismiss the quadratic equation entirely, deeming it too abstract or irrelevant to practical healthcare decisions. This overlooks the potential for sophisticated mathematical models to reveal underlying patterns and relationships that are not immediately apparent. By ignoring the insights derived from the equation, professionals miss opportunities to optimize care pathways or identify systemic inefficiencies, which can be considered a failure to leverage available evidence for the betterment of patients and the institution. A third incorrect approach is to focus solely on the mathematical manipulation of the equation without understanding its contextual meaning within the health program. This might involve correctly solving for the roots, but failing to interpret what those roots signify in terms of patient risk, treatment efficacy, or resource demand. This disconnect between mathematical solution and practical application represents a failure to translate data into meaningful insights, undermining the purpose of using such analytical tools in a professional setting. Professional reasoning. Professionals should approach such situations by first understanding the context and purpose of the mathematical model. They should then focus on interpreting the output of the model, such as the roots of a quadratic equation, in terms of their practical implications for patient care, resource management, or program evaluation. This involves asking, what do these numbers mean in our specific context? The decision-making process should involve a critical evaluation of the model's assumptions, limitations, and the sensitivity of its outputs to changes in input data. Collaboration with data analysts or statisticians can be beneficial to ensure accurate interpretation and appropriate application of the findings. The ultimate goal is to use the insights gained from the mathematical analysis to make informed, ethical, and effective decisions that benefit patients and the healthcare system. Question 9. The analysis reveals that a student in a health graduate program is struggling to differentiate between terms related to cellular respiration. They are seeking a word that signifies the opposite of anabolism in the context of cellular energy processes. Which of the following terms, when used as an antonym for anabolism, best reflects the opposing metabolic pathway in cellular energy dynamics? Option A, synthesis. Option B, respiration. Option C, catabolism. Option D, metabolism. The correct answer is C, catabolism. Explanation. Scenario analysis. This scenario presents a challenge in precise communication within a health graduate program context. The need to accurately convey complex concepts using appropriate terminology is paramount for effective learning and future professional practice. Misinterpreting or misusing synonyms can lead to misunderstandings of critical health-related principles, potentially impacting patient care or research integrity in the future. Correct approach analysis. The correct approach demonstrates a nuanced understanding of semantic relationships, recognizing that while synonyms share similar meanings, subtle differences can be crucial in specific academic or clinical contexts. In health sciences, precision in language is not merely academic. It directly relates to the accurate identification of conditions, treatments, and biological processes. Choosing the most precise synonym ensures that the intended meaning is conveyed without ambiguity, aligning with the rigorous standards expected in graduate-level health education and practice. This upholds the principle of clarity and accuracy in scientific discourse. Incorrect approaches analysis. One incorrect approach might involve selecting a synonym that is too general or lacks the specific connotation required in a health sciences context. For instance, using a common term when a more technical, precise medical term is appropriate could lead to a superficial understanding of the subject matter. This failure to adhere to specialized vocabulary can be seen as a lapse in professional diligence, as it suggests an insufficient grasp of the field's established terminology. Ethically, it could be argued that this demonstrates a lack of commitment to mastering the subject to the highest standard. Another incorrect approach could be choosing a synonym that, while seemingly similar, carries a different etymological root or historical usage that subtly alters its meaning in a scientific context. This might lead to an inaccurate conceptualization of a health-related phenomenon. From a regulatory perspective within an academic program, this would represent a failure to meet the learning objectives and demonstrate mastery of the subject matter, potentially impacting academic progression. A third incorrect approach might involve selecting a word that is a homophone or a near homophone, but has a completely different meaning, leading to a nonsensical or misleading statement. This is a clear failure of basic linguistic accuracy and demonstrates a lack of careful attention to detail, which is a critical attribute for health professionals. Such an error would undermine the credibility of the student and their understanding of the material. Professional reasoning. Professionals in health graduate programs should approach synonym and antonym identification with a focus on precision and context. The decision-making process involves 1. Understanding the core meaning of the target word. 2. Identifying potential synonyms and antonyms. 3. Evaluating each potential word against the specific context of the health sciences, considering technical accuracy, common usage within the field, and potential for misinterpretation. 4. Selecting the word that most accurately and unambiguously conveys the intended meaning, prioritizing scientific rigor and clarity. Question 10. Benchmark analysis indicates that effective communication of health-related research findings to a diverse audience requires careful attention to sentence construction. Which of the following best exemplifies a sentence structure that promotes clarity and coherence in such a context? Option A. The novel therapeutic agent, through its administration in a randomized controlled trial, showed a significant improvement in patient outcomes, with symptom severity reduced and quality of life enhanced. Option B. Administering the novel therapeutic agent resulted in statistically significant improvements in patient outcomes, including reduced symptom severity and enhanced quality of life, as evidenced by the randomized controlled trial design. Option C. Patient outcomes, symptom severity, and quality of life were all positively impacted by the novel therapeutic agent, a finding supported by the randomized controlled trial. Option D. The study, which involved a randomized controlled trial design, demonstrated a statistically significant improvement in patient outcomes when the novel therapeutic agent was administered, leading to a reduction in symptom severity and an enhanced quality of life for the participants. Correct answer is D. The study, which involved a randomized controlled trial design, demonstrated a statistically significant improvement in patient outcomes when the novel therapeutic agent was administered, leading to a reduction in symptom severity and an enhanced quality of life for the participants. Explanation. Scenario analysis. This scenario presents a professional challenge in communicating complex health information to a diverse audience, including patients, caregivers, and other healthcare professionals. The challenge lies in ensuring clarity, accuracy, and adherence to established communication standards within the health sector, particularly when discussing research findings or treatment protocols. The need for precise language and logical sentence structure is paramount to avoid misinterpretation, which could have significant implications for patient care and research integrity. Correct approach analysis. The correct approach prioritizes clear, concise, and logically sequenced sentences that accurately convey the intended meaning without ambiguity. This aligns with best professional practices in health communication, which emphasize patient understanding and the accurate dissemination of scientific information. In the context of the GRE for health programs, this translates to demonstrating an ability to construct well-formed sentences that effectively communicate complex ideas, a skill essential for academic success and future professional practice. Regulatory and ethical guidelines in healthcare universally stress the importance of clear communication to ensure informed consent, patient safety, and the integrity of research. Incorrect approaches analysis. An approach that uses overly complex sentence structures with excessive jargon and convoluted phrasing fails to meet the fundamental requirement of clear communication. This can lead to misinterpretation by the intended audience, potentially causing confusion, anxiety, or incorrect actions. Ethically, it violates the principle of beneficence by not making information accessible and understandable, and it can undermine patient autonomy by hindering informed decision-making. An approach that employs vague or imprecise language, lacking specific details or clear connections between ideas, also falls short. This can result in a lack of credibility and can obscure critical information. From a regulatory standpoint, it may violate guidelines that require accurate and complete reporting of health-related information. An approach that presents information in a disorganized or illogical sequence, jumping between unrelated points, or failing to establish clear transitions, hinders comprehension. This can make it difficult for the reader to follow the argument or understand the relationships between different pieces of information. Professionally, this demonstrates a lack of critical thinking and an inability to structure information effectively, which are core competencies expected in graduate-level health programs. Professional reasoning. Professionals in health-related fields must develop a robust decision-making process for communication that involves 1. Identifying the target audience and their level of understanding. 2. Determining the core message to be conveyed. 3. Structuring the information logically and sequentially. 4. Using clear, precise, and appropriate language. And 5. Reviewing and revising for clarity, accuracy, and completeness. This systematic approach ensures that communication is effective, ethical, and compliant with professional standards. Question 11. The evaluation methodology shows that a radiologist is reviewing a CT scan of a patient's knee. The radiologist observes that the patella, when viewed from a specific angle, appears to form a quadrilateral shape. To accurately assess for potential abnormalities such as fractures or dislocations, which of the following interpretations of this observation is most professionally relevant and aligned with diagnostic principles? Option A. The observation that the patella forms a quadrilateral shape is noted, and the radiologist will focus on memorizing the different classifications of quadrilaterals, e.g., square, rectangle, rhombus, to categorize the observed shape. Option B. The observation that the patella forms a quadrilateral shape is noted, and the radiologist will proceed to count the number of sides to confirm it is indeed a quadrilateral, as this is the primary characteristic. Option C. The observation that the patella forms a quadrilateral shape is significant because the specific angles and relative lengths of the sides of this quadrilateral can indicate the degree of alignment and potential stress points within the joint. Option D. The observation that the patella forms a quadrilateral shape is noted, and the radiologist will attempt to recall the specific formula for calculating the area of a general quadrilateral to see if it applies. The correct answer is C. The observation that the patella forms a quadrilateral shape is significant because the specific angles and relative lengths of the sides of this quadrilateral can indicate the degree of alignment and potential stress points within the joint. Explanation. This scenario presents a professional challenge because it requires a health professional to interpret and apply abstract geometric concepts to a real-world patient care situation, specifically in the context of diagnostic imaging interpretation. The challenge lies in moving beyond rote memorization of shapes to understanding their functional implications in a medical setting, while adhering to the ethical and professional standards expected within the GRE's health graduate program context, which implicitly emphasizes evidence-based practice and patient safety. The correct approach represents best professional practice because it demonstrates a nuanced understanding of how geometric properties, such as the angles and relative positions of structures within a polygon, can directly inform diagnostic accuracy. In medical imaging, recognizing deviations from expected polygonal formations, e.g., in bone structures or organ boundaries, can be a critical indicator of pathology. This approach aligns with the GRE's emphasis on analytical reasoning and the application of knowledge to solve complex problems, which is paramount in health sciences. It reflects a professional who can translate theoretical knowledge into practical diagnostic insights, thereby ensuring accurate patient assessment and treatment planning, which is a core ethical responsibility. An incorrect approach that focuses solely on the number of sides of a polygon, without considering their arrangement or the angles between them, fails to grasp the diagnostic relevance. This is a regulatory and ethical failure because it leads to superficial analysis and potentially misdiagnoses. Professionals are ethically bound to apply their knowledge comprehensively, not just in a superficial manner. Another incorrect approach that prioritizes memorizing the names of various polygons over understanding their visual representation in an image is also a failure. This demonstrates a lack of practical application and an inability to connect theoretical knowledge to the visual data presented in diagnostic imaging, which is essential for patient care and can lead to misinterpretations. A third incorrect approach that attempts to apply complex mathematical formulas to the shapes without a clear diagnostic purpose is also problematic. While mathematical principles underpin imaging technology, the professional's role is to interpret the results of these technologies, not to re-engineer them or engage in unnecessary calculations. This can be seen as a failure in efficient and effective professional practice, potentially wasting valuable time and resources and deviating from the core diagnostic task. Professional decision-making in such situations requires a framework that prioritizes diagnostic relevance and patient outcomes. This involves 1. Understanding the underlying principles of the diagnostic modality. 2. Recognizing how anatomical structures are represented geometrically in the imaging. 3. Identifying deviations from normal geometric patterns that may indicate pathology. And 4. Integrating this geometric interpretation with other clinical information to form a comprehensive diagnosis. The focus should always be on how the geometric properties contribute to understanding the patient's condition and guiding treatment. Question 12. During the evaluation of a patient's eligibility for a new therapeutic intervention, a healthcare provider encounters a guideline that states, eligibility is determined by the product of the patient's age, A, and their serum creatinine level, C, being less than or equal to a threshold value, T. The provider must decide how to assess the patient based on this rule. Which of the following represents the most accurate and professionally sound approach to determining eligibility? Option A. Assess eligibility based solely on the patient's serum creatinine level, assuming that higher levels indicate a need for the intervention. Option B. Ignore the guideline and make a decision based on the provider's clinical experience with similar patients. Option C. Assess eligibility based solely on the patient's age, assuming that older patients are less likely to qualify. Option D. Calculate the product of the patient's age and their serum creatinine level, and compare this product directly to the threshold value. The correct answer is D. Calculate the product of the patient's age and their serum creatinine level, and compare this product directly to the threshold value. Explanation. Scenario analysis. This scenario presents a professional challenge where a healthcare provider must interpret and apply a guideline that uses algebraic concepts to determine patient eligibility for a specific treatment. The challenge lies in accurately translating the abstract algebraic relationship into a concrete clinical decision, ensuring patient safety and adherence to established protocols. Misinterpretation could lead to inappropriate treatment allocation, impacting patient outcomes and potentially violating professional standards. Correct approach analysis. The correct approach involves understanding that the guideline establishes a direct, proportional relationship between two quantifiable patient factors, e.g., age and a specific biomarker level, and a threshold for treatment eligibility. This means that as one factor increases, the other must also increase or decrease in a predictable manner to meet the criterion. This approach represents best professional practice because it adheres strictly to the established regulatory framework for treatment eligibility, ensuring consistency and fairness in patient care. It prioritizes accurate interpretation of the guideline's intent, which is to objectively assess patient suitability based on defined parameters. Incorrect approach is analysis. One incorrect approach would be to focus solely on one of the variables in the guideline without considering its relationship to the other. This fails to acknowledge the algebraic nature of the rule, which dictates a combined effect. Ethically, this could lead to overlooking critical patient factors, potentially resulting in undertreatment or overtreatment, violating the principle of beneficence and non-maleficence. Regulatory failure occurs by not applying the guideline as written. Another incorrect approach would be to assume a linear relationship when the guideline implies a more complex algebraic function, e.g., a quadratic or exponential relationship. This misinterpretation of the mathematical model could lead to inaccurate eligibility determinations. This represents a failure to understand the nuances of the guideline, potentially leading to the exclusion of eligible patients or the inclusion of ineligible ones, thus failing to meet the regulatory requirements for equitable access to care. A further incorrect approach would be to disregard the guideline entirely and rely on anecdotal experience or intuition. This is a significant ethical and regulatory failure. It abandons the established, evidence-based criteria designed to ensure objective and consistent decision-making. It violates the principle of accountability and professional responsibility to follow established protocols. Professional reasoning. Professionals should approach such situations by first thoroughly understanding the mathematical concept underpinning the guideline. This involves identifying the variables, the type of relationship, e.g., linear, inverse, proportional, and the specific threshold. They should then translate this abstract relationship into a practical clinical assessment, ensuring all components of the rule are considered. If ambiguity exists, seeking clarification from the guideline's authors or relevant professional bodies is crucial. This systematic approach ensures adherence to regulations, ethical principles, and best practices in patient care. Question 13. Cost-benefit analysis shows that a new public health intervention to reduce the incidence of a chronic disease has a favorable net benefit, but its implementation would disproportionately benefit a wealthier segment of the population due to upfront costs for access. Considering the logical flow of evaluating such an intervention for graduate-level health program admission, which approach best demonstrates critical thinking and ethical reasoning? Option A. Dismissing the intervention entirely due to the identified equity concerns, despite the favorable overall cost-benefit analysis. Option B. Prioritizing the intervention's overall net benefit as indicated by the cost-benefit analysis, assuming that any positive outcome is sufficient justification. Option C. Advocating for the intervention's immediate implementation based on the positive cost-benefit ratio, while deferring discussions about equitable access to a later stage. Option D. Recommending a phased implementation strategy that addresses equitable access concurrently with the rollout of the intervention, ensuring that the benefits are distributed justly, even if it slightly delays the overall net benefit realization. The correct answer is B. Prioritizing the intervention's overall net benefit as indicated by the cost-benefit analysis, assuming that any positive outcome is sufficient justification. Explanation: this scenario presents a professional challenge because it requires balancing the potential benefits of a new health intervention against its costs, while also considering the ethical implications and regulatory compliance within the Graduate Record Examinations GRE framework for health graduate programs. The GRE, as a standardized assessment, focuses on evaluating a candidate's readiness for graduate-level study, which includes their ability to critically analyze information, understand logical reasoning, and apply knowledge in a health context. The challenge lies in discerning the most logical and ethically sound progression of ideas when evaluating such an intervention, rather than simply identifying a mathematically optimal outcome. The correct approach represents best professional practice because it prioritizes a comprehensive and ethically grounded evaluation. It acknowledges that while cost-benefit analysis is a valuable tool, it must be integrated with a thorough understanding of the intervention's impact on patient well-being, equity, and adherence to established health guidelines. This approach reflects the GRE's emphasis on critical thinking and the application of knowledge in a nuanced manner, ensuring that decisions are not solely driven by financial metrics, but also by ethical considerations and the ultimate goal of improving health outcomes. This aligns with the implicit regulatory and ethical expectations of health professionals to act in the best interest of patients and society. Incorrect approaches fail because they overemphasize a single aspect of the analysis, leading to a flawed logical flow. One incorrect approach might focus exclusively on the cost-benefit ratio, without adequately considering the ethical implications of access or potential disparities in benefit. This would be a regulatory and ethical failure, as it neglects the principle of beneficence and justice, which are foundational in health professions and implicitly assessed in graduate program admissions. Another incorrect approach might prioritize anecdotal evidence or preliminary findings over robust, evidence-based conclusions, demonstrating a lack of critical appraisal skills and a failure to adhere to scientific rigor, which is a core expectation for graduate-level study in health fields. Such an approach would also be ethically problematic by potentially leading to premature or unsupported conclusions that could impact patient care or public health recommendations. The professional decision-making process for similar situations should involve a structured, multifaceted approach. Professionals should begin by clearly defining the problem and the scope of the analysis. Next, they should gather relevant data from credible sources, considering both quantitative and qualitative information. This should be followed by an evaluation of the data using appropriate analytical frameworks, such as cost-benefit analysis, but always within an ethical and regulatory context. Crucially, professionals must critically assess the limitations of their analysis and consider potential biases. Finally, they should synthesize their findings into a coherent and well-reasoned conclusion, prioritizing the well-being of individuals and communities, and adhering to professional standards and ethical principles. This systematic process ensures that decisions are informed, justifiable, and ethically sound. Question 14. The performance metrics show a consistent trend of lower than expected scores in the quantitative reasoning section of the Graduate Record Examinations GRE, for applicants to health graduate programs. Which of the following actions best aligns with the regulatory framework, laws, and guidelines specified for the graduate record examinations, GRE, for various health grad programs? Option A. Interpret the lower quantitative reasoning scores as an indication that the GRE is not an appropriate measure for success in health graduate programs, and consider advocating for its removal for these specific programs. Option B. Conduct a comprehensive review of the health graduate program's curriculum to identify potential gaps in foundational quantitative skills taught, and assess whether these skills are adequately integrated and reinforced in coursework relevant to health sciences. Option C. Focus on providing extensive GRE preparation workshops for all prospective applicants, emphasizing test-taking strategies for the quantitative reasoning section, irrespective of the program's curriculum content. Option D. Immediately revise the admissions criteria to require a higher minimum score on the quantitative reasoning section of the GRE, without further investigation into the root cause of the performance trend. The correct answer is B. Conduct a comprehensive review of the health graduate program's curriculum to identify potential gaps in foundational quantitative skills taught, and assess whether these skills are adequately integrated and reinforced in coursework relevant to health sciences. Explanation. Scenario analysis. This scenario presents a professional challenge where a healthcare provider must interpret performance metrics in the context of regulatory compliance for health graduate programs. The challenge lies in understanding how these metrics relate to established standards and guidelines, ensuring that patient care and educational integrity are maintained without violating any applicable regulations. The provider needs to exercise careful judgment to differentiate between acceptable deviations and those that indicate non-compliance. Correct approach analysis. The correct approach involves a thorough review of the performance metrics against the specific regulatory framework, laws, and guidelines for the graduate record examinations, GRE, relevant to health graduate programs. This means consulting official GRE documentation, any associated health program accreditation standards that reference GRE requirements, and relevant institutional policies. The focus should be on identifying any discrepancies or trends that suggest a failure to meet the established benchmarks for program quality or student preparedness as assessed by GRE performance. This approach represents best professional practice because it is directly aligned with the mandate to adhere to the specified regulatory jurisdiction, ensuring that all actions and interpretations are grounded in the official requirements of the GRE for health graduate programs. It prioritizes accurate understanding and application of the rules, which is fundamental to ethical and legal operation within the educational and healthcare sectors. Incorrect approaches analysis. One incorrect approach would be to dismiss the performance metrics as merely indicative of general student aptitude, without cross-referencing them to specific GRE requirements for health graduate programs. This fails to acknowledge the regulatory obligation to assess program effectiveness and student readiness through standardized measures as defined by the GRE framework. It represents an ethical failure by neglecting a key component of program evaluation mandated by the governing body. Another incorrect approach would be to interpret the metrics based on general educational best practices or anecdotal evidence from other disciplines, without strictly adhering to the GRE's specific guidelines for health graduate programs. This violates the principle of jurisdictional compliance by introducing external, non-applicable standards. It is a regulatory failure because it bypasses the defined parameters of the GRE's assessment for this specific context. A third incorrect approach would be to focus solely on improving the metrics through superficial means, such as altering the curriculum to teach to the test, without a genuine understanding of the underlying skills the GRE aims to assess for health graduate programs. This approach, while seemingly metric-focused, can lead to a failure to meet the spirit of the regulations, which is to ensure a robust foundation for health professionals. It is an ethical and professional failure as it prioritizes appearance over substance and potentially compromises the quality of education and future patient care. Professional reasoning. Professionals in this context should employ a systematic decision-making process. First, they must clearly identify the governing regulatory framework, GRE for health graduate programs. Second, they should obtain and thoroughly understand the specific performance metrics and the benchmarks set by the GRE. Third, they must compare the metrics against these benchmarks, looking for deviations that could signal noncompliance. Fourth, if deviations are found, they should investigate the root causes, considering factors related to curriculum, student support, and program design, always within the bounds of the GRE's stated objectives. Finally, they should implement corrective actions that are both compliant with the GRE regulations and ethically sound, ensuring the integrity of the educational program and the preparedness of its graduates. Question 15. Regulatory review indicates that a research study on a new postoperative pain management protocol has yielded recovery times for a cohort of patients. To effectively communicate the typical recovery experience to a patient considering this protocol, which measure of central tendency would best represent the central point of the recovery times, especially if a few patients experienced unusually long recovery periods? Option A. Range of recovery times as it captures the full spectrum of patient experiences. Option B. The mode recovery time as it identifies the most frequently occurring recovery duration. Option C. The median recovery time as it is less affected by extreme values and provides a better representation of the typical patient's recovery. Option D. The mean recovery time as it incorporates all data points and is a standard measure of central tendency. The correct answer is C. The median recovery time as it is less affected by extreme values and provides a better representation of the typical patient's recovery. Explanation. This scenario presents a professional challenge because a healthcare provider must interpret and communicate statistical information accurately to inform patient care decisions, while adhering to ethical principles of transparency and patient autonomy. The challenge lies in selecting the most appropriate measure of central tendency to represent patient outcomes in a way that is both statistically sound and easily understood by non-experts, avoiding misleading interpretations. The correct approach represents best professional practice because it prioritizes clarity and representativeness of the data. When dealing with patient outcomes that may be skewed by outliers, e.g., a few extremely long or short recovery times, the median provides a more robust measure of the typical patient experience than the mean, which can be disproportionately influenced by extreme values. This aligns with ethical obligations to provide accurate information and avoid misrepresenting the effectiveness or typical course of a treatment, thereby empowering patients to make informed decisions. An incorrect approach that relies solely on the mean without considering data distribution fails to adequately represent the typical patient outcome. This can lead to a misinformed patient or a flawed clinical judgment if the mean is skewed by unusual cases. Ethically, this constitutes a failure in providing accurate and representative information, potentially violating principles of beneficence and non-maleficence by leading to suboptimal decisions based on misleading data. Another incorrect approach that focuses only on the mode would be inappropriate if the data is continuous or if there are multiple modes, making it an unreliable indicator of central tendency for this type of health outcome data. Relying on the mode in such cases would be a statistical misapplication, leading to an inaccurate understanding of the typical patient experience and potentially violating professional standards for data interpretation. The professional reasoning framework for similar situations involves 1. Understanding the nature of the data, e.g., continuous discrete presence of outliers. 2. Identifying the purpose of the statistical measure, e.g., describing typical outcome, comparing groups. 3. Selecting the measure of central tendency that best represents the data for the intended purpose, considering its robustness to outliers and ease of interpretation. 4. Communicating the chosen measure and its implications clearly and transparently to relevant stakeholders, including patients. Question 16. The efficiency study reveals a significant increase in patient wait times at the clinic's primary care department, with preliminary analysis suggesting that the current staffing levels in the triage area may be insufficient to manage patient flow during peak hours. However, the study's methodology has not been independently verified, and some staff members have expressed concerns about potential data collection errors. Which of the following actions would be the most appropriate initial step to address the reported increase in patient wait times? Option A. Immediately request additional nursing staff for the triage area to alleviate the perceived understaffing and reduce wait times. Option B. Implement a new patient scheduling system designed to spread out appointments more evenly throughout the day, without further investigation into the triage area's specific issues. Option C. Conduct a thorough review of the efficiency study's methodology and data collection processes, and simultaneously gather input from triage staff regarding their workflow and perceived challenges. Option D. Advise clinic management to disregard the study's findings due to potential data collection errors and await further, more robust research. Correct answer is C. Conduct a thorough review of the efficiency study's methodology and data collection processes, and simultaneously gather input from triage staff regarding their workflow and perceived challenges. Explanation: the efficiency study reveals a discrepancy in patient wait times at a community health clinic, suggesting potential understaffing in the triage area. This scenario is professionally challenging because it directly impacts patient care quality and resource allocation, requiring a nuanced understanding of operational efficiency within a healthcare context. Professionals must balance the need for timely care with the practical constraints of staffing and budget. Careful judgment is required to identify the root cause of the discrepancy and propose effective, ethical solutions. The correct approach involves a comprehensive review of the study's methodology and data, followed by a collaborative discussion with the clinical and administrative staff. This approach represents best professional practice because it adheres to principles of evidence-based decision-making and stakeholder engagement. By seeking to understand the full context of the wait times, including patient flow, staff workload, and potential bottlenecks, professionals can identify the most accurate cause of the inefficiency. This aligns with ethical obligations to provide quality care and to use resources responsibly. Furthermore, involving staff fosters buy-in and ensures that proposed solutions are practical and sustainable. An incorrect approach would be to immediately implement staffing changes based solely on the initial study findings without further investigation. This fails to acknowledge the complexity of healthcare operations and could lead to misallocation of resources or unintended negative consequences on staff morale and patient experience. It bypasses the critical step of validating the data and understanding contributing factors, potentially violating the ethical principle of acting with due diligence. Another incorrect approach is to dismiss the study's findings outright due to a perceived lack of statistical significance or potential bias in data collection, without conducting an independent assessment. A critical evaluation of data is important. Outright dismissal without investigation can lead to overlooking genuine issues affecting patient care. This could be seen as a failure to uphold the professional responsibility to ensure patient well-being and to address systemic problems. A third incorrect approach is to focus solely on punitive measures for staff perceived as inefficient, rather than examining systemic issues. This is ethically unsound and professionally detrimental, as it creates a negative work environment and fails to address the underlying causes of inefficiency, which may be related to processes, resources, or training rather than individual performance. This approach neglects the collaborative and supportive aspects of professional healthcare management. Professionals should employ a decision-making framework that prioritizes data validation, stakeholder consultation, and a systems thinking approach. This involves 1. Critically evaluating the presented data and study methodology. 2. Gathering additional qualitative and quantitative data to corroborate or refute findings. 3. Engaging relevant staff and stakeholders to understand their perspectives and identify contributing factors. 4. Developing and evaluating potential solutions based on evidence and feasibility. 5. Implementing chosen solutions with clear metrics for success and ongoing monitoring. Question 17. Compliance review shows that a recent risk assessment for new medication indicates a statistically significant increase in a rare adverse event, P0.05. However, the confidence interval for this increased risk is very wide, encompassing both a negligible increase and a moderately concerning increase. The review also notes that the study's methodology had some limitations regarding patient selection. Which of the following represents the most appropriate next step for the health program to take in assessing and managing this risk? Option A. Conduct a further, more robust study to refine the estimate of the adverse events incidence and its clinical significance, while temporarily implementing precautionary measures based on the potential for a moderate risk. Option B. Disregard the finding as not clinically relevant because the confidence interval includes a negligible risk and the study had methodological limitations. Option C. Immediately halt all use of the medication due to the statistically significant finding, regardless of the wide confidence interval or methodological limitations. Option D. Rely on the statistical significance alone and proceed with standard risk management protocols without further investigation, assuming the risk is minimal. The correct answer is A. Conduct a further, more robust study to refine the estimate of the adverse events incidence and its clinical significance, while temporarily implementing precautionary measures based on the potential for a moderate risk. Explanation: this scenario is professionally challenging because it requires a health professional to interpret statistical findings from a risk assessment and translate them into actionable, ethically sound decisions within the constraints of a specific regulatory framework. The core difficulty lies in balancing the statistical evidence of risk with the ethical imperative to protect patient well-being and adhere to established guidelines, all while avoiding misinterpretation or over-reliance on statistical significance alone. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the risk assessment's implications, considering both statistical validity and clinical relevance. It involves a multifaceted evaluation that includes examining the confidence interval to understand the uncertainty around the point estimate, considering the magnitude of the effect in addition to its statistical significance, and critically assessing the methodology and potential biases of the study. This aligns with ethical principles of beneficence and non-maleficence, ensuring that interventions are evidence-based and proportionate to the identified risk. Furthermore, it adheres to the implicit regulatory expectation of due diligence in risk management, which requires more than just a superficial glance at p-values. An incorrect approach that focuses solely on statistical significance, e.g., a p-value below a predetermined threshold, fails to account for the practical implications of the findings. A statistically significant result might represent a very small, clinically irrelevant effect, leading to unnecessary interventions or patient anxiety. This can be seen as a failure of proportionality and potentially a violation of the principle of avoiding harm, as interventions carry their own risks. Another incorrect approach that dismisses findings solely because they are not statistically significant, even if the confidence interval suggests a potentially meaningful effect, can lead to missed opportunities to mitigate risks. This could be considered a failure of due diligence and potentially a breach of the duty of care if a reasonable professional would have investigated further. Relying on anecdotal evidence or personal experience over the statistical risk assessment, even if statistically significant, represents a failure to adhere to evidence-based practice, a cornerstone of modern healthcare regulation and ethical conduct. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the statistical output, point estimates, confidence intervals, p-values. Second, contextualizing these findings within the clinical setting and patient population. Third, considering the magnitude and clinical relevance of the identified risk. Fourth, evaluating the quality and limitations of the risk assessment methodology. And finally, making a decision that is both statistically informed and ethically justifiable, in line with relevant professional guidelines and regulations. Question 18. Implementation of a new, expensive diagnostic imaging technology is being considered for a hospital department. A senior clinician advocates for its immediate adoption, citing potential for earlier detection of certain conditions. However, the department's budget is already strained, and a less expensive, established technology can detect many of the same conditions, albeit with slightly lower sensitivity and requiring more follow-up tests in some cases. The department head must decide whether to proceed with the new technology, delay its adoption, or explore alternative solutions. Which of the following represents the most professionally sound approach? Option A. Prioritize the use of the less expensive, established technology and defer any consideration of the new technology until the department's budget significantly improves. Option B. Conduct a comprehensive cost-benefit analysis that includes the long-term patient outcomes and resource utilization associated with both the new and existing technologies, and involve the clinical team in evaluating the diagnostic accuracy and clinical utility of the new technology in the context of the patient population. Option C. Immediately approve the purchase of the new technology to ensure the department remains at the forefront of medical advancements, regardless of the immediate budgetary constraints. Option D. Implement the new technology for a limited trial period on a small subset of patients to gauge its effectiveness and cost efficiency before making a full commitment. The correct answer is B. Conduct a comprehensive cost-benefit analysis that includes the long-term patient outcomes and resource utilization associated with both the new and existing technologies, and involve the clinical team in evaluating the diagnostic accuracy and clinical utility of the new technology in the context of the patient population. Explanation. This scenario presents a professional challenge because it requires a health professional to balance the immediate needs of a patient with the financial realities and ethical considerations of resource allocation within a healthcare system. The core of the challenge lies in making a decision that is both clinically sound and fiscally responsible, while adhering to professional standards and patient well-being. Careful judgment is required to avoid bias and ensure equitable access to care. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the patient's needs and the potential benefits of the proposed treatment. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it adheres to professional guidelines that mandate individualized care plans and the justification of treatment decisions based on clinical efficacy and patient outcomes. This approach ensures that decisions are not solely driven by cost, but by a comprehensive evaluation of what is best for the patient within the available resources. An incorrect approach that focuses solely on the cost of the treatment, without a thorough clinical evaluation, fails to uphold the principle of beneficence. It risks denying a patient potentially beneficial care based on a narrow financial perspective, which can be considered unethical and a failure to act in the patient's best interest. Another incorrect approach that prioritizes a less effective but cheaper alternative, without considering the patient's specific condition and potential for poorer outcomes, violates the principle of non-maleficence and can lead to suboptimal care, potentially increasing long-term costs due to complications or prolonged illness. An approach that relies on arbitrary cost-cutting measures without a clear rationale or patient-specific justification disregards the professional obligation to provide evidence-based and patient-centered care. The professional decision-making process for similar situations should involve a systematic evaluation. First, clearly define the patient's clinical needs and the proposed treatment's objectives. Second, gather all relevant clinical information, including evidence of the treatment's efficacy and potential risks. Third, consider the available resources and their limitations, but do not let this be the sole determinant. Fourth, engage in shared decision-making with the patient, explaining the options, benefits, risks, and costs. Finally, document the decision-making process and the rationale behind the chosen course of action, ensuring it aligns with ethical principles and professional standards. Question 19. Process analysis reveals that a patient with a terminal illness who has been receiving aggressive treatment expresses a clear and consistent desire to discontinue all life-sustaining interventions and focus on comfort care. The healthcare team is aware of the patient's previous discussions about advanced directives, but the current request is more immediate and emotionally charged. What is the most appropriate next step for the healthcare team? Option A. Consult with the patient's family to determine the best course of action, prioritizing their input over the patient's current expressed desires. Option B. Immediately initiate the process to withdraw all life-sustaining interventions as per the patient's stated wishes. Option C. Proceed with discontinuing interventions based on the assumption that the patient's previous advance directives fully cover this immediate situation. Option D. Conduct a thorough assessment of the patient's decision-making capacity and engage in a detailed discussion about their current wishes, understanding of their prognosis, and treatment options. Correct answer is B. Immediately initiate the process to withdraw all life-sustaining interventions as per the patient's stated wishes. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of a patient with the ethical and regulatory obligations of healthcare providers. The core of the challenge lies in discerning when a patient's expressed wishes, particularly regarding end-of-life care, align with established medical standards and legal frameworks, and when they might indicate a need for further assessment or intervention. The GRE, in its role for health graduate programs, emphasizes the importance of understanding these complex ethical and regulatory landscapes. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered evaluation that respects autonomy while ensuring patient safety and adherence to legal and ethical guidelines. This involves open communication, thorough assessment of the patient's capacity to make decisions, and consultation with relevant parties, including family and the interdisciplinary team. This aligns with the ethical principles of beneficence, non-maleficence, and respect for autonomy, as well as regulatory requirements for informed consent and appropriate care planning. An incorrect approach that focuses solely on immediate compliance with a patient's stated desire for withdrawal of life-sustaining treatment without a thorough capacity assessment would be a significant regulatory and ethical failure. This could violate the principle of beneficence by potentially hastening harm if the patient's decision is not fully informed or is influenced by treatable factors like depression or delirium. It also fails to uphold the regulatory requirement for ensuring a patient's decision is made with informed consent, which necessitates capacity. Another incorrect approach, such as overriding a patient's clearly expressed wishes based on personal or family beliefs, would violate the principle of autonomy and could lead to legal repercussions for battery or lack of informed consent. The professional decision-making process in such situations should involve a structured approach. First, assess the patient's decision-making capacity. If capacity is present, engage in a detailed discussion about the patient's values, goals of care, and understanding of their condition and treatment options. If capacity is questionable, initiate a formal capacity assessment. Throughout this process, maintain open communication with the patient, their family as appropriate and with patient consent, and the healthcare team. Document all assessments, discussions, and decisions meticulously. When in doubt, seek consultation from ethics committees, legal counsel, or senior clinicians. Question 20. Stakeholder feedback indicates significant distress among patients regarding the perceived lack of timely communication about treatment plan adjustments, with the author's tone conveying frustration and a sense of being overlooked. The author's primary purpose appears to be advocating for improved patient involvement in decision-making processes. Which of the following represents the most appropriate initial response to this feedback? Option A. Respond by highlighting the existing communication policies and procedures, emphasizing that staff are trained to follow them, and suggesting that individual patient experiences may vary. Option B. Issue a general statement assuring all stakeholders that patient care is a top priority and that all feedback is valued, without specific mention of the communication issue. Option C. Immediately implement a new, complex electronic system for all patient communications to ensure comprehensive record keeping and reduce the possibility of missed information. Option D. Acknowledge the emotional content of the feedback, express empathy for the patient's experience, and initiate a review of current communication protocols for treatment plan changes, involving patient representatives in the review process. The correct answer is D. Acknowledge the emotional content of the feedback, express empathy for the patient's experience, and initiate a review of current communication protocols for treatment plan changes, involving patient representatives in the review process. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs and concerns of a vulnerable patient population with the broader ethical and regulatory obligations of healthcare providers. The author's tone and purpose in the feedback are critical to understanding the underlying issues and formulating an appropriate response. Misinterpreting the tone could lead to dismissiveness, while failing to grasp the purpose could result in ineffective or even harmful interventions. The correct approach involves a measured and empathetic response that acknowledges the feedback's emotional undercurrents while focusing on actionable improvements. This aligns with professional best practices in patient advocacy and quality improvement, which emphasize active listening, transparent communication, and a commitment to patient-centered care. Regulatory frameworks, such as those governing patient rights and quality assurance in healthcare settings, though specific GRE-relevant regulations are not provided, general principles of ethical healthcare practice apply. Support a process that prioritizes patient well-being and addresses concerns constructively. An incorrect approach would be to dismiss the feedback as overly emotional or unfounded. This fails to recognize the legitimate distress of the stakeholders and neglects the opportunity for crucial insight into potential systemic issues. Ethically, this demonstrates a lack of empathy and a disregard for patient experience, potentially violating principles of respect and beneficence. Regulatory failure here would lie in not establishing or adhering to processes for grievance resolution and quality improvement that are responsive to patient and family concerns. Another incorrect approach is to immediately implement sweeping changes without thorough investigation or understanding of the author's specific concerns. While appearing proactive, this can be inefficient, costly, and may not address the root cause of the problem. It also risks alienating staff if changes are perceived as reactive and unsupported by evidence. Ethically, this could lead to unintended negative consequences for patients or staff if changes are poorly conceived. The professional decision-making process for similar situations should involve 1. Active listening and empathetic acknowledgement of the feedback, recognizing the author's tone and potential underlying emotions. 2. Identifying the core purpose and specific concerns raised by the feedback. 3. Gathering further information through appropriate channels, e.g., direct communication, surveys, incident reports, to validate and understand the issues. 4. Collaborating with relevant stakeholders to develop evidence-based, patient-centered solutions. 5. Implementing changes systematically and monitoring their effectiveness. 6. Communicating progress and outcomes transparently.